Apologies, let's start again. Welcome to Care Across Cultures with me, your host, Mirban Hussain. You're listening to us on Link FM 96.7, linking communities. Please join the conversation today on 0114 261 8181. You can always send us a WhatsApp message on 07939 849 339. We're talking today about something that's really important. A new project, a new program that's happening. And I've got a wonderful guest today. Just to make you aware that any opinions expressed on the program belong to me and my guest and are not necessarily the views and opinions of Link FM or of the organisations that we represent. So, every year in the UK, lung cancer claims more lives than any other cancer. There's a thought. Yet we know that early detection through cancer screening can save thousands of those lives. I'm one of those, and I've talked about that before on my programs. The challenge is getting screening to the communities that need it most. Today we'll be exploring a new, and I'm going to say a groundbreaking approach that's turning traditional healthcare on its head. How about instead of waiting for patients to come to you, services go out to them? We'll be talking about that a little bit later. And by partnering with faith groups, community organisation, local leaders, wouldn't it be fantastic if we could break down the barriers that people away from life-saving healthcare? I'm joined today by my guest Hannah Young. Hello, Hannah.
Hello.
How
nice
are you
to be
this
here.
morning?
I'm good, thank you.
Hannah, I think I was just looking back at my notes from all the programmes, and you were here in February, I think.
Was it February?
Yeah. And when I just started the programme, we talked about lung cancer screening, didn't we? Yeah. And welcome back.
Thank you for having me back.
So, just tell us a little bit more about who you are, what you do, and who you work for.
Okay, so I am Hannah Young. I am the Comms and Engagement Senior Officer for lung cancer screening in South Yorkshire and Bassetlaw, and that's for the Cancer Alliance and the NHS South Yorkshire ICB.
Right.
So, yes.
What's an ICB? I have sort of mentioned it before, but just so that we never know who's listening and they may not have heard it before.
Yeah, okay. So ICB stands for Integrated Care Board, and it just sort of brings together people, organisations across South Yorkshire, and commissions services for our population.
So would it be right in me saying that they're the people who get the money from government, national government, and then they're the ones that then sort of distribute it out to various organisations?
Yeah, it comes from NHS England.
NHS England,
yeah,
right,
yeah.
okay.
And they fund the Cancer Alliance, who
fantastic.
I work for, yeah.
So, now let's have a conversation today. We're not, I've got some questions, but we're going to have a conversation today, if that's okay. A reality check. What's missing from screening? Okay. So, Hannah, when you look at who shows up for lung cancer screening versus who doesn't, what do you see?
I mean, it can vary across areas. Obviously South Yorkshire and Bassetlaw that we cover as well, very, very varied county, very diverse, but usually we're seeing lower uptake in the more deprived areas. and ethnic minority communities,
Mhm.
and people that don't have English as a first language
Okay.
as well. So they're the people I think the programme as a whole is trying to reach, but
Mhm.
you know, me especially.
Yeah.
I'm a Core 20+5 Health Inequalities Ambassador,
Okay.
and
You are going to have to explain
I
that.
know. I was
Okay.
just going to say.
I'm sure that a lot of people don't understand what Core 20+5 actually means.
No, well, Core 20 is the sort of the most
Twen-
deprived percentage,
Uh-huh.
like 20%. That population,
Mhm.
and that could be deprivation to not just financial.
Mhm.
You know, that could be to do with health education, general education,
Mm.
employment, that kind of thing.
Those kinds of things.
Yeah,
Okay.
and the +5 is 5 areas that the project wants to sort of focus on,
Okay.
and early cancer detection is one of those.
Is one
so-
of those. Okay. Fantastic. So what you've mentioned earlier in terms of who don't show up sounds very familiar
Yes.
across the board in health, doesn't it?
Yeah, it's not just for lung cancer.
No, it's not
screening.
just for lung cancer. But you've had some good results in the lung cancer screening, haven't you, since it's been started?
Absolutely. Yeah.
Have you seen? I know that you've had a huge increase in numbers of people who are going for the lung cancer. Has that increase also happened in the ethnic minority community? Have you seen many of those?
We have seen an increase since I think it was February time actually, because I brought some here. We have had translations done. We've
Yes.
got different languages on the promotional assets.
Mhm.
So as part of my job, I travel around the different GP practices
Yeah.
and leave like pull-up banners,
Yes.
posters, information for them.
Mm.
To help reassure the patients, and they can find out more about it. So since we've had the languages on the posters,
Mhm.
we've also had languages added to the back of the invitation letter.
Mhm.
So we have noticed an increase since then.
Okay.
So that's really positive.
Is it too early to put a number to it at the moment?
Yes, I think so. I don't have the most recent stats, but they are being pulled together
Okay.
by our provider. So fingers crossed, I'll be able to share.
Perhaps
those.
when you have that, you could pass it on to me,
Absolutely.
and
Yeah,
I could
definitely.
sort of mention it. You may even be able to come back and
Oh.
give us an update, because I think it's really important. Because when you have screening programs like this, which we know save lives,
Yeah, absolutely.
and getting them out to all of the communities, it's really key, isn't it?
Yeah,
And I think if we can show that we've actually seen this percentage increase amongst these particular communities,
yeah,
that's going to sort of help other members of those communities to take up the cancer screening, and perhaps
Totally.
other communities as well.
yes.
Okay. So we talked about the what we don't see in terms of people who don't access, but what do you think are the biggest barriers stopping people from getting screening that you've come across?
I suppose the main one is understanding what it's all about, really. I try to do as much as I can in terms of getting out into the community and
Yes.
speaking to people, and it's wonderful seeing the light bulb moment when they ask a question and and then they're like, oh, okay. Yes, I love that. I love that moment. Just reaching one extra person makes all the difference to me. But it's understanding what it's all about, and the process as well, which is why we did the video to
The
help
video.
explain, which Oscar-worthy performance.
Oh,
from
wow.
you. But that's getting a lot
yeah.
of positive feedback.
Is it?
As
So
well.
that's good.
Yes,
That's good.
definitely. People are finding that very beneficial.
If you just want to sort of talk a little bit more about the video, because we may have new listeners and people may have missed it previously.
Okay.
What's that about?
So the team, even before I started, have wanted to produce a video, an information video, to talk about the process and what happens. And although not everybody will need a scan from the back of the lung cancer screening, because it's in two parts. The first part is just a phone call, which is another big misconception. It's a non-invasive screening program, unlike the others
Yes.
that can be considered quite invasive. So you might need to remove your coat for the scan.
Yes.
But we wanted to give people a better understanding of, literally step by step what happens from when you arrive at the scan, going through the scanner, and leaving. And you can have arrived, had your scan, and left within 10-15 minutes.
Yeah.
So
And
it's
that's very
really
true.
quick.
Yeah, that's
Yeah.
very true.
Yeah. So I approached Mervyn, who is I
That's me, by the way,
Yes,
guys. Okay,
yes,
that's me.
exactly. Who I consider a powerful program ambassador. You're always more than happy to help and share your experience, which is amazing. And you were our actor, weren't you, in the video?
Yeah. One thing, I mean, it's a bit of an aside, but one thing, because this is a conversation that we always have at this programme. It made me realise and understand what actually real actors, go through and what they're faced
You're a
with.
real actor.
Okay, because I think I was there for about 4 or 5 hours, and the video's only about 3 minutes long, and I had to sort of, even walking, getting out of the car was 5 takes, and then walking was another 5 takes, and you have to repeat all of this
Different angles.
from
as
different
well, yeah.
angles over and over again. And my experience was that all I was doing was just sort of walking or sitting or taking my coat off or getting out of the car, which is a normal thing that most people do in their life. And then I thought about all these action movies and everything else that goes on, and I'm thinking that there's a lot of sitting around and waiting and a lot of
Yes.
repetition. Yeah, so if it's a 3-hour film, just imagine how long that takes. And this is a learning thing, isn't it? We learn all the time that being part of something, and this is why I think the actual walk-through video is really important. I think it's really powerful,
Yes.
and that's why I want to do it, because there are many people that I come across who may have never been to a hospital.
Yeah.
They get this letter through for a lung cancer screening and a CT scan, and we hear about CT scans, and then we hear about lung cancer screening, and then all of a sudden there's this whole emotional thing that takes over.
Yeah.
But the actual process is very simple. And when I went through it, on a personal level, 2.5 years ago, I thought, well, 15 minutes out of your life, out
Yeah.
of your day. And the key point I want to mention, and we've talked about this, haven't we? Just because you've been invited for a lung cancer screening test does not mean that you've got cancer.
No, not at all.
And that's a key thing that I want you to sort of perhaps share a little bit more about, in terms of why you get these sent, okay, and what does it actually mean.
Yes,
Yeah.
absolutely. So if you're aged between 55 and 74 years old, and have told your doctor that you either are a current smoker or used to smoke, you'll be invited to have lung cancer screening. Now, these people are chosen because they are at a higher risk, so it's just a risk of getting lung cancer. and that's based on
Lots
a
of
lot
research.
of
A lot of
research.
research.
Yeah. So, and it's the best time to catch it early, which is the whole point of screening.
Yes.
You know, screening is for well people. Lung cancer itself often has no symptoms until a much later stage.
I didn't have any symptoms.
No, exactly. That's it. You know, you think that people are going to be coughing all the time, you know, breathless, but it's not necessarily the case. You know, we've got another programme ambassador who was part of the very first cohort in Doncaster back in 2021, and she was exactly the same. No symptoms whatsoever. Something was found. She had an operation, and she's cancer-free.
Cancer-free.
Yeah.
And that's the amazing thing, isn't it?
Yeah, exactly. So it doesn't mean you have it.
Yes.
It doesn't mean you might have it. It just means you are at an increased risk, and should anything be found, it's so much better to get it early. I mean, like you said, I am a firm believer it is not just a physical diagnosis.
No.
If anything is found, it's an emotional and mental diagnosis as well. You know, we're trying to reduce the stigma with
Yes.
the word cancer and its connotations, you know, what it means for people.
There is, I'm sorry to interrupt,
No,
but
it's fine.
there is this movement in terms of the terminology, the word cancer. That to most people, it still seems like a death sentence.
Yeah.
And we know through all the work that's been carried on in the past 30 years or so that it's not necessarily that.
No.
There are many cancers which are treatable. There are many, you know, cancers that even, you know, which aren't treatable or curable. You can still have a good life with lots of treatment. Okay.
Yeah.
So there's that as well. There's, I was reading something around cancer. There's a push now to make cancer into a sort of an illness.
Yes, a long-term condition.
A long-term
Yes.
condition.
Yeah, that's
Yeah.
that's the thing.
Rebadging it.
Living with cancer.
It's living with
Yeah.
cancer rather than what it was
Dying
before,
from, I suppose,
dying
Yeah.
from cancer, which is a really important, and that's because of all the wonderful work that everybody that's been involved with cancer has been doing
Yeah.
over the many, you know,
Yeah.
years that, and I do feel that, I mean, this is a personal opinion, that a bit like mental health, we have to talk about it because the more we talk about it, the easier it becomes,
Yeah.
and it's no longer taboo. And the same thing with cancer.
Yeah.
Let's talk about it. Let's get it, and use the terminology, because there is this thing around mental health, for example, where sometimes people, we'll call it wellness, or we'll call it something else, which is all very well, I think, you know, when you're explaining it to someone, or when you're having a community event or something like that. But what happens when that person ends up accessing mental health services? They're all called mental health, aren't they? The doctors will be talking about mental health.
Yeah.
All your professionals, nurses, will be talking about mental health. When you go, you know, when you get a letter, it'll be mental health services. So then, is there not then another shock? Ooh, I thought it was
Maybe.
well-being.
Yes. Yeah.
But it's not, you know. Oh, that's just a personal opinion. I think, you know,
Yeah.
we have to call
Absolutely. And I
what
think
it is, and
that
if
might have been why the. Sorry, I just interrupted.
no,
you.
carry on, please.
I think that's why, cause from April this year, the programme's name was changed. It used to be Targeted Lung Health Check Programme, and that was done initially
Yes.
because of, partly because of the fear of the word cancer, and lung cancer in particular, because you know you're presenting late, you've got your symptoms,
Yes.
so it's at a later stage. Often there's not much time between diagnosis and that person passing away. So, you know, people were fearful. But this programme has shown that, you know, it can save lives.
It can save lives, yeah.
It has.
You know, it has,
You
and
know, you're the
I've met
example.
many people, you know, throughout my work.
Mm.
And I always think that, you know, and you said it earlier, right at the beginning of the programme, if through these programmes we can save one life, yeah,
It's worth it to me.
it's
but
worth it,
yes,
isn't it? It's worth it.
Fortunately, it's been a lot more.
But hope, yeah, but, you know, we have saved more, and these
Mm.
programmes are so important.
Yeah.
Before we go into a break, because we're coming into a break very soon, how would you approach communities who've had bad experiences? And we've only got a few minutes.
Bad
And
experience.
yeah, a bad experience
Okay.
of not of particularly lung cancer or this screen, but bad experiences of maybe the NHS or the GPs or services in specific.
Oh gosh,
You know,
okay. I suppose it all starts through communication,
Yeah.
through, you know, conversations with them. If I'm at any events, you know, I strongly encourage people to come up and have a chat. No question's a silly question.
Yeah.
And, you know, people, because of the age limit at the top, people will say to me, oh, well, I'm 76, do I not matter?
yes,
And obviously they matter.
of course.
You know, that's it. This is just one way into the
Yeah.
screening process to have your lungs checked.
Yeah.
So I think it's important to talk to people,
Yes.
and if they already have people they trust
Yeah.
within those communities, you know, me sort of liaising with those people as well for them to also spread the message is really useful.
And this is why, and this will lead us into our next sort of section, which is about this new project that you've got,
Oh,
you're
okay.
starting, and it's about liaising with religious leaders, community leaders, and have those health conversations, because it's a partnership model that we're looking at, isn't it? So, if you've just joined us, you are listening to Care Across Cultures on Link FM 96.7. With me, your host Mirban Hussain, and my guest Hannah Young. We're just going into a short commercial break. Please stay with us, and we'll be back shortly. Assalamu alaikum. Welcome back to Care Across Cultures with me, your host Mirban Hussain. You're listening to us on Link FM 96.7. Our studio hotline is 0114 261 8181. Or you can send us a WhatsApp message on 079 398 49339. You'd have thought after 32 weeks, I should know these numbers off by heart, shouldn't you? Not having to sort of read them off the off the board in front of me. But there you go. There you go. I've been talking with Hannah Young from South Yorkshire ICB and South Yorkshire Ambassador Lung Cancer Alliance lung cancer screening programme. So, we've talked about lung cancer screening, Hannah, and we've talked about the video, and we've talked about why this is really important. Before I go on to the next part, which is about this new community partnership model project that you're setting up, you said to me the other day, last week, I think, that the lung cancer screening program has restarted earlier than you thought it would. Is that right?
No,
Is that me?
No, it's not you at all. Yes, but I think that was sort of to do with like behind the scenes type
Oh,
stuff.
right, okay.
Yeah, and it's not really it's not affected things,
Okay.
you know, as we thought, or as, you know, starting earlier might do.
Okay.
It's just a case of sort of getting round to everyone, just letting them know, I suppose.
Okay.
Invites have, I think, started going out now to our Rotherham residents, our eligible population in
Right.
Rotherham, as I mentioned earlier, 55
Yes.
74, current or former smoker.
Yeah.
So yes, we're sort of back, if you like, for round 2 of the lung cancer screening programme. Obviously, you were part of round 1.
So it's not a healthy lung check anymore. It's now lung cancer screening.
It's lung cancer screening, but I did mention earlier, not everybody needs a scan,
Right.
and it's in 2 parts.
Okay.
So they're still using the terminology lung health check.
Yes.
So that's part 1,
Mhm.
where you'll have a conversation with a respiratory nurse
Mhm.
who will ask you questions about your lifestyle,
Yeah.
your medical history, family medical history,
Mhm.
that kind of thing, and then you are scored.
Mhm.
And if you meet a certain score,
Mhm.
that will determine whether your risk is higher
Right.
of getting lung cancer,
Oh.
not necessarily having it. So, you know, again, I do appreciate these things aren't necessarily easy.
Yes.
Process-wise, a phone call just sound very easy. But, you know, then if this, like I say, if the score meets a certain threshold, that's when you'll be referred for a scan. So a lot of people, it's about half,
Yeah.
don't need a scan, and it's
Don't
just a
need a
phone
scan.
call.
Just a phone call. I'm just going to sort of translate that, if that's okay.
Of course.
हाँ जी, अभी अभी मैं बात कर रहा था हाना योम के साथ, जो कैंसर लंग कैंसर स्क्रीनिंग प्रोग्राम है ना, वो अब भी जारी है, और अभी अभी मेरा ख्याल है इस वीक या लास्ट वीक जो खत वो डालते हैं, भेजते हैं आपको, उन लोगों ने शुरू कर दिया। तो अगर आपको खत आए आपके नाम पर, तो 2 पार्ट होगा। एक तो पहले वो आपको बुलाएंगे, टेलीफोन कॉन्वर्सेशन, एक टेलीफोन पर बात करेंगे, तो आपसे कुछ जो है ना सवालात करेंगे। उन सवालात के बाद जो नर्स है ना टेलीफोन पर, वो डिसाइड करेगी कि अगर आपको सीटी स्कैन की ज़रूरत है कि नहीं। हाना कह रही थी कि 50% जो है ना, 50% लोगों को ज़्यादा जो है ना सीटी स्कैन की ज़रूरत नहीं पड़ेगी। तो अगर आपको ये लेटर आए तो ज़रूर जो है ना उनसे रब्ता करना। So I just thought it was important just to sort of mention that, in case, you know, some of my listeners, you know, don't have English as a first language.
Absolutely.
Okay, so let's talk about this new innovative approach that you're looking at. Tell me a bit more about it.
I mean, I like that you're calling it innovative. We will we'll see how it goes, definitely. But as I mentioned earlier, being a health inequalities ambassador, I'm very passionate about trying to reduce health inequalities. It's one of the main objectives of the lung cancer screening programme as well. So finding lung cancer earlier, but also reducing the health inequalities gap. And
It's a bit warm, so I've turned the AC
okay, we're having some climate control.
on. Yes.
And as we discussed earlier, you know, we're seeing that people who don't have English as a first language, ethnic minorities, aren't coming forward as readily. So while that we are seeing a change in that, a positive change with the languages on the letters and things, I mean, you know, you have to put yourself in their situation. You know, if everything to me was in a language I couldn't read,
Yes.
I not only wouldn't know anything about
Yes.
it, but wouldn't be able to book my appointment, etc.
Yeah.
So we're trying to overcome that, and then I think it's important as well, especially as you mentioned, the Pakistan Muslim community is huge in Rotherham.
It is. It's a lot. It's the largest after the white British. Yeah.
Exactly, and you know, I do find it frustrating sometimes when, you know, everything is aimed at, you know, the white English native speakers, because that's not what England is about. We're such a diverse country, wonderfully diverse.
Mhm.
You know, everybody's got a part to play in society,
Of
and
course.
you know, I think it's important to make a proactive effort to involve everybody, to reach
I think
everybody.
proactive is the key word, isn't it? It's about, and this is why I said earlier, when I think at the beginning, it's, and the reason I called it innovative, it's not about patients coming to us, to a
Yes.
service, it's about the actual service going to the patients. And that can be done in so many different ways, can't it? I know that we only talked about this project last week, and
Yes,
I'm putting you a bit on the spot.
it's fine.
Okay. Who are you partnering with in terms of delivering this?
Well, the plan is, you know, as I've said, sort of reaching the seldom heard groups, as they're
Yes.
called, the underserved communities. So that involves ethnic minority groups,
Yes.
faith groups. So initially, I suppose, as I've reached out to you to see if you're able to support, but it will be like local to Rotherham, because we're starting small, if you
Yes,
like, in
yeah.
Rotherham, as we do with any sort of different approach, and then obviously if it works, we'll
We'll
roll it out.
roll
if
it
you like,
out
to the
across,
rest of
yeah, the rest of South Yorkshire,
and Bassetlaw, yeah.
and potentially the rest of England.
Well, who knows?
Who knows? I mean, you know,
The world
because
is our oyster.
it's a thing, isn't it? Because I mean, if it's a successful project, which I'm sure it will be, and then other alliances, cancer alliances across the country. Because I just want to make a point here that although that we do talk about Rotherham and Sheffield on this programme, cancer services are available throughout the country.
Yes.
Okay? So wherever you are, no matter where you live in the UK, there are local cancer services to you.
Support,
There are
yeah.
hospices close to you. There are lung cancer screening programmes close to where you are.
Or if not currently, they will
Or if
be
not
starting.
currently, they will be starting.
Yeah.
Yeah.
Because it is going to be a national screening
Right,
programme
yeah.
now, yeah.
So this is it. I mean, this it started what, 2021?
I think
22,
before, I
yeah.
think it was about we started in South
Right,
Yorkshire in
yeah.
2021, but I think it started sort of 2019ish as 10 pilot
Yes.
cancer alliances,
Mhm.
and the pilot results were so successful,
Yeah.
as in finding lung cancers earlier,
Yeah.
and some other cancers as well,
Mhm.
that has been approved. It's going to be a national screening programme by the end of the decade, just like bowel, breast, cervical.
Of course, yeah. I'm really enthusiastic about you approaching Rotherham Hospice. To partner up in this because as a cancer specialist, hospices are. If we can work together and do a really good job, then hopefully save lives, and hopefully it could be a model that other areas can then
Yeah.
adopt. That'd be great. Yeah.
Exactly.
So there were a couple of things within your brief that you shared with me that I just wanted to talk about. Reinvesting directly back into the community. Okay.
Yeah.
What's that? What does it mean, and what would it look like in practice
Yeah.
with this program?
Okay. Well, it's important to me. You know, we're servicing these communities. You know,
Mhm.
we're offering this service, and that's because our populations are important to us. And we also appreciate perhaps for example, like the community groups that run. You know, they're a lifeline for some people,
They are.
and they are often run by volunteers, and get little to no funding, you
Very
know,
minimal funding. Yes. Yeah.
Yeah, I think that's fair to say.
Yeah.
So, you know, and I think there's a lot of people that would be a bit lost without
Mm-hmm.
them, regardless of what they are. You know, it might not be to everybody's taste, but
Mm.
that's the beauty of a human, I suppose. We all like different things, and I think it's important to support these groups and work with the relevant ones to who we're trying to reach. I go round and speak to various different groups and talk to them about lung cancer screening and what they can do and things. I speak to people that run the groups. You know, if a group's quarterly, for example, you know, the timing might not be right, but if I share the information with
Yes.
the hosts of
Yes.
the group,
Yeah.
then they can share the information far and wide. But I think that's vital, really. I think we need to reinforce the sense of community as much as we can. Communities have sort of disappeared, haven't they? Really, with,
They have,
with
yeah.
everything sort of everything's online. You know, and you even get your shopping delivered
You do. Yes.
straight to your house. So, you know, things have changed, and that's what happens in society. I appreciate that. Things progress.
Well, they do. Yes. I mean, you know, it's
Depends how you view
there
it.
is a digital revolution as well in healthcare as
Absolutely.
well.
Yes.
As something that I will be talking about on this program at some point.
Mm.
And I'm really excited by that because it's going to reach potentially a lot more people. Not just people in general who might be rural or who can't act, you know, because of bus services and they can't act,
Yeah.
but people who may be ill, unwell,
Yeah.
or people who live alone.
Yeah.
And there are always those positives that we look out for as well,
Yes.
aren't there? There's always
Absolutely.
there's always negatives
Yeah.
as well, but you know, this is a very positive program.
Mm.
So here's a what might be a difficult question.
Oh gosh.
What's the difference between asking communities, actually partnering with communities, than rather just asking them when we design services?
It's about sort of involving them more, really, finding out what they need, utilising the data and insights, the demographics and things, you know, information about the community. There's a quote from Henry Ford. I'm sure it's Henry Ford.
Yeah.
It says, you know, if I'd have asked the people what they wanted, they'd have said a faster horse.
Faster course, yes.
Which obviously, you know, he then
Yes.
developed the motor car.
Yeah.
So people don't necessarily always know what they want
No,
or
no.
what they need. I
Yeah.
don't know, but you still need to involve them, get
Yes.
opinions that could
Yeah.
lead to
Yeah.
other things. I presume he took faster out of that
Yes.
and thought, well, let's
Let's
go even faster than that.
Yeah.
Which obviously, you know, cars are faster than horses.
Yes. Yeah.
But you know, while it's important, you can sort of glean bits of how you can work together, or you know, like we've had conversations where I've said, oh, I'm looking to do this, and you know, you've thought, well, what about this, this, and this? You know, so it's bouncing ideas off each other, community-wise, and you know, just truly involve them, working together. The collaboration is really important. I mean, some things aren't doable, and that's just how it goes. But it's important to be honest about that as well. If people say, "Oh, well, could you bring the scanner here?" for example,
Of course.
and the answer, unfortunately,
No.
is usually no.
No. Yeah.
You know, because of the cost.
There are cost involvements and there's the
Logistics,
logistics. There's,
But yeah, involving them, being
Mm.
honest, and talking to them is really important. You know, asking them for their opinions is great, but it's almost a, so what? What are you going to do with my information that I've given you? And then sort of feeding that back. I think people just want to be involved and understand. So I think that's really important.
There are some percentages from equality, diversity and inclusion that I wanted to just sort of share with you.
Okay.
And this is, you know, research, actual work that's been done by international organisations like Google and Amazon and, you know, people like that.
Right, okay.
Okay. What they've found is that a diverse workforce where you've got just 50-50 of men and women, your productivity increases by 15%. Okay?
Wow,
These are
okay.
all, you know, you can Google
Yeah,
this
yeah.
stuff, yeah? If you've got a diverse workforce ethnically, your productivity increases by 30%.
Wow.
Okay, so this is actual stuff that's been done by international companies. And if we look at Amazon and Google and the likes,
Mm.
how successful are they in terms of, income generation, reach,
Yeah.
integration, all of those kinds of things. So this, to me, what you're wanting to do is about we're not just including, or you're not just including diverse communities. You actually want to work with them as equal partners and learn and then deliver what works for them. Does that
As best we
sound
can,
about?
absolutely.
Does
yes.
that sound about right?
Yeah,
Yeah.
because you know, even our perspectives on lung cancer screening will differ based on life experience and you know our needs, if you like, our healthcare needs. So you know, if we can understand the populations that we serve,
Yes.
we can better engage them.
There is one question I have for you, which comes to mind straight away,
Oh.
is translators.
Oh yes.
Okay.
Yeah.
Have you got a resource or budget within your project to fund translators? I'm not talking about, when I talk about translators, I'm not talking, interpreters actually, not translators. I'm not talking about the community group leaders or people like that. You know, I'm talking about professional translators, interpreters. Is that something that...
I'm hoping to,
Yeah.
definitely. I think it would be useful, just, you know, when I go to events even, just to have somebody there who can...
And there is an issue that I want to raise with you in terms of interpreters.
Okay.
We have generic interpreters. What you were going to be talking about is a specific healthcare condition.
Yeah.
And so interpreters, are highly qualified when they've got a diploma, and it's a really difficult one to do. It's, some of my colleagues and family members have gone through the process, and it's not an easy. It's not an easy qualification.
Okay.
It's a very difficult qualification. But then that's about language.
Mm-hmm.
Okay, it's not about knowledge of.
Yeah.
It's knowledge of language,
Yeah.
but not
Also,
knowledge of
Yeah.
a specific.
Yeah.
And I was thinking that if you are going to be using interpreters, have you thought about giving those interpreters some training in terms of the terminology, the medical terminology of
Yeah.
cancer?
Yes.
Because it
Yeah.
can mean so many different things because many languages you can't translate the word cancer into many
Right.
different languages.
Okay.
Like you can't mental health either. Okay,
right.
so there are those kinds of things, isn't
Yeah.
it? It's just something for you to
yeah,
think about.
definitely. It's those details
Yeah.
that, I
Yeah.
think it's so important to, like I
Yeah.
say, talk to people and better understand things, because yeah, I wouldn't have sort of
So,
thought about that.
if
I
you've
suppose.
just tuned in, you are listening to Care Across Cultures with me, Mirban Hussain, your host. You are listening to us on Link FM 96.7. We are coming to the end of the programme. Thank you for listening and thank you for joining us. We've been talking to Hannah Young from South Yorkshire and Bassetlaw Cancer Alliance. It's always a mouthful to say that.
It is, I'm sorry.
Who has been talking about lung cancer screening programs. She's been talking also about a new project that's starting off in Rotherham,
Yes.
which is actually it'll be about lung cancer screening,
Yes, it
but it's about going into the communities and working with the communities.
will. Yeah.
Okay. A partnership approach,
Yeah.
which I'm really
definitely.
excited about. Hannah's excited about. Now, if you do want to get involved, and this is a shout out to everybody out there, organisations in Rotherham,
Faith
community
leaders,
leaders,
yeah.
members of the public, if you want to get involved, please get in touch with either myself at Rotherham Hospice or with Hannah Young. And if you just Google Hannah Young at South Yorkshire Cancer Alliance, you will find her. Okay, but either way, I'm sure that out there are people who can really support this, and all
Which
the
would be
skills are out there. It'd be fantastic if you
Yeah.
do that. So, and Hannah, what I want, I don't want to say, okay. What would success look in 5 years?
Oh gosh. For lung
Considering
cancer
you haven't
screening-
even started
Oh, this project, you
this
mean?
project. Yeah.
Oh, it would be brilliant to have a network of contacts, I suppose.
Yeah.
You know, faith leaders throughout the county, not just Rotherham.
Mhm.
You know, I would hope we've moved on to different areas by then, depending on the success of this. So it's really important that we reach different faith leaders.
Fantastic. And I'm going to have to cut you off
Oh,
because we've only got about
sorry.
50 seconds.
Oh gosh.
Have you got a final sort of shout out you want, a final message in a few seconds?
If you get your letter, if you have any concerns about anything healthcare related, if you get your letter, go for your screening. And if any other concerns, please go talk to a healthcare professional.
Thank you so much. Thank you for joining us. You've been listening to Care Across Cultures with me, Mirban Hussain, your host on Link FM 96.7 with the wonderful Hannah Young. That's the end of the programme today. Inshallah, Allah Hafiz, and we'll be here next week.